Hi, my name is Nicole Mattis, and this week in Nursing 374, we are addressing the issue of quality improvement and how it is a formal approach to the analysis of performance and systematic efforts to improve it. The U.S. Agency for Healthcare Research and Quality defines quality healthcare as doing the right thing at the right time, in the right way for the right person, and having the best possible results. Looking at a specific case, we will discuss the issue of an overcrowded clinic. The problems with this clinic is that it is a multi-ethnic, multilingual community health primary care clinic that cannot handle its current patient load. The majority of the patient population are below the poverty line and facing complex medical and psychological issues. Appointment wait times exceed 6 to 8 months, even for acutely ill patients. The walk-in patients exceed the number of appointments available, and 20 to 40% of patients no-show on a daily basis. Physicians, therefore, are double booked due to the fact that they must fill their slots when they are in the clinic. So, what went wrong within this clinic? The quality and experience of the healthcare provided is lacking due to the limited access to care. The better insured English proficient patients tend to get better access due to the ease of scheduling and the fact that they are more assertive. The better the communication patients have, the more likely they are to show up and keep appointments. Patients are labeled as non-compliant, but in reality, this system is just too difficult to navigate. Patients are therefore forced to seek care in emergency departments when they cannot be seen in the clinic. Some proposed solutions to this clinic's issue are to poll patients to discover the root cause of the issues, to start a potential open access program for scheduling appointments, to offer multilingual services, and educate the staff on multicultural concerns. If open access were to be instituted, it would allow for same-day appointments with no reminders to be sent out to maximize time for staff. There would be convenient scheduled timing offered so appointments wouldn't disrupt work or family schedules, such as early morning or late evening appointments. There would be longer, more inclusive visits. It would increase overtime for staff. However, patients would be able to consistently see the same physicians rather than just the first available. Within this clinic, there is a need for multidisciplinary roles. Care is currently provided by physicians. However, there is a need to offer care from nurse practitioners and physician's assistants as well. This would lighten the load of all physicians. Currently, general and psychiatric care are provided. However, there is a need for social services as well as case management to help the population overall. Furthermore, medical assistants and registered nurses on staff are readily available, but with this, there's a need for interpreter services so that we can help them to be more efficient. Some other proposed solutions would first be a telecare option for patients who cannot leave work or have simple complaints such as a need for medication refills or requests for diagnostic testing. Second would be a small charge for no-shows and a contract system that would discourage walk-ins and late visits. Third, round-robin visits, whereby patients would originally see a medical assistant where they could obtain vital signs and a basic history. Next, they would see a physician assistant, nurse practitioner, or doctor. They would be examined. The nurse would carry out any orders the practitioner prescribes. Then, after they're seen by the nurses and physicians. Social work or case management would come in to schedule follow-up appointments, as well as answer any questions that a patient might have and offer assistance with other needs such as home health. Another option would be first come, first serve for patients who have appointments or who have called ahead. Those who are late or walk-ins, unfortunately, would have to wait. Finally, I would assign a triage acuity to each patient and ensure that the most acute were seen first. Some potential barriers to this system would be that some patients will not come at all if they feel that they will be penalized for late or no-shows. Next, the biggest issue would be that there's additional need for funding in order to increase staffing. There's also a need for bigger spaces in order to offer these additional services. Finally, since low-cost services do not make competitive wages an option, staff retention would be an issue. And last, education for staff would take time, and there would need to be incentives for staff to pursue the education outside of work hours. Thank you for your time.